Hi everyone. We're creating a video with some great intake workers from the East to launch the MSCA navigation guide to help other services find our services and refer their clients smoothly to us. So with me today, I have representatives from the ECADS line, which is in the Inner East, and the Shore line, which is for the Outer East. So we're going to do a little bit of an introduction using the skills and experience of our workers at the intake, and these are the lines here. Now we have Inner East and Outer East, and we do encourage you to call the one where the client lives, but we do have a no wrong door policy. So that means if you call either of those lines, you're going to make it to the services anyway. The other thing is that these services can provide you with a bit of information if you're really not sure what to do either, or you're not sure which direction to go with the client. So without further ado, I'll introduce our amazing clinicians from the East. Go ahead.
Yeah, sorry. Hi, my name's Marion. I'm an intake clinician from Turning Point based in Box Hill. And my team here, we're the central intake team for the ECADS program, which covers the Inner East.
My name's Emma. I am an intake clinician with the Outer East, so the Shore program, covering clients living in the Outer East, so Maroondah, Knox and Yarra Ranges.
Thanks. And I am a manager in the AOD sector in the service development area, and I'm hosting this one today. My name's Carmen, and let's get on to our presentation. So first we're going to talk about what AOD services are actually available, and it won't be a comprehensive list, but it will be an overview of the top line items. So first, let's actually talk about intake, and I'll hand over to you two. Please just jump in and tell our audience what intake is.
Yeah, so I'm happy to kick it off. So intake is basically the first point of call for clients who are wishing to seek AOD support or AOD treatment. It's sort of the first stop and often where people start their journey. So clients can call us, we can have a chat, and we can complete assessments and refer accordingly.
Great. Emma, did you want to add to that one?
No, so if you just call the intake service that your client is living in, and we'll do an intake screen and refer to a counsellor or case manager, whichever service is relevant to the client.
Great, thanks, Emma. All right, assessment, and in alcohol and drug services, addiction services, we call this the AOD comprehensive assessment.
So in regards to assessment in the Inner East, if a client was to call and wishing to engage with services, we begin with an intake assessment or an intake screen, as Emma mentioned before, which takes maybe 15 minutes to get a general understanding of the client's situation. And then from there, a comprehensive assessment would be done, which is building upon that. So it's a longer, more thorough assessment.
Yeah, so we could complete that screen at the assessment at intake if needed, but more likely they'd be allocated to a counsellor to complete the comprehensive assessment and then commence working with that counsellor in a counselling capacity.
Fantastic. And in AOD, we do a comprehensive biopsychosocial assessment that tries to understand all the factors that are impacting the client. Counselling.
So counselling in particular is done in that catchment-based manner. So it's sort of where the inner and the outer east matter, because we like to link clients up to counsellors who are near to where they live for sort of convenience, of course. So this is where we'd link clients up with drug and alcohol counsellors for that sort of one-on-one support to work with sort of on an ongoing basis.
Yeah, at the moment, a lot of services are doing phone counselling and telehealth, but others are also back to doing face-to-face. This is all a free, voluntary, ongoing service, so we can just renew that as needed.
Yeah, so it's really based on how much counselling the person needs for their different issues around the alcohol and drugs. Fantastic. So the next one is care and recovery coordination. Can someone demystify that one for us?
So care and recovery is a referral and linkages service. So it might be suitable for a client that has a few sort of complex needs. Maybe they need a referral to Detox, Rehab, housing, financial counselling. So a Client would be working with a care and recovery coordinator, and the care and recovery coordinator would make these referrals as needed for the client. And they might also work hand in hand with the counsellor who's providing more of a therapeutic support. So care and recovery is really about referrals and support and advocacy for the client.
Great.
So I guess CRC and counselling can also happen at the same time. So a client can have a CRC clinician and a counsellor as well. And this is the other service that matters with the inner and the outer east. You can find, if you're not sure which catchment you fit in or your client fits in, you can look up Direct Line Service Finder. It's on the internet, and it really, really easily shows you the relevant intake service for that location.
Great. Thanks, Marion. Thanks, Emma. Next is another one that might need a little bit of explanation, which is non-residential withdrawal.
Yeah, so non-residential withdrawal is for people who are wanting to withdraw from substances at home. They'll have some support from a non-residential withdrawal nurse, as well as work with a GP to get the right medication to support them to withdraw safely at home. So it's not suitable for everybody because they might not be assessed as safe to withdraw at home outside of a hospital setting. But should they be suitable, they would call the intake line. We would do an intake and assessment and do the referral directly to a non-residential withdrawal nurse.
Fantastic. And I guess that's one of the things that I learned coming into the AOD sector was that people may actually need some support to come off a substance, including alcohol, and it may not be safe to do so without some support, whether that's non-residential or residential. So it's important to think about getting some support for a client around coming off a substance. Okay, now that leads us directly into residential detox and rehab.
So residential detox and rehab, firstly to differentiate between the two, detox is about that short-term stay, so it might be 1 to up to 4 weeks depending on the program, where a client would come in and detox from whatever substance they're using in a safe and supported environment. And rehab is really about that sort of longer term stay, so a rehab stay might be a couple of months for sort of that ongoing rehabilitation and support. So here at Turning Point in Box Hill, we do have a detox facility called Wellington House, which is located next to the hospital. We do also have a Ward 1 East. Unfortunately, at the moment, our detoxes have been affected by COVID, and so there has been some changes to how we run things. But if anyone has any questions about the changes to our programs, then welcome to call the intake line. We're happy to have a chat. But at Wellington House, the client would come in and stay with us for that period of time while we sort of support them both medically and with other programs to sort of withdraw from that substance.
Great. And I guess it's worth noting that during COVID, if you're unsure about what's available and when, it's a really great point, Marion, to just call the intake line and find out. Often websites and things might have an indication too, but that's your most up-to-the-minute information on what's going on. And I guess it's good to hear that support hasn't been compromised completely, that we're still offering services through COVID. It's great. Emma, did you want to add anything?
Just note, to be referred to detox and rehab, a client needs to have a current intake screen, comprehensive assessment and self-complete form, as well as a referral from their GP with their medication and medical summary. So generally we would begin that process at intake, and a care and recovery or care and recovery clinician or a counsellor can help assist with the referrals to detox and rehab. Yeah, and
Really
they can go to any detox or rehab across Victoria. It doesn't have to be within their catchment.
Yeah, great points, Emma. It's good to know that there's a bit of a process for getting in, so to set expectations that, you know, we do have to make sure that that's the right thing for the person, and that there's a bit of a process that will guide them through what that is. And we actually do most of those forms. And we do even have, I know we have doctors at Turning Point that can sometimes assist with this sort of thing. So yeah, that's really, really excellent points. Ready to move on?
So.
Great. Okay, so how does intake work for referrers? So let's say we've got somebody over at EDVOS in a specialist family violence specialist family violence sector, and they want to refer a client over. What's the process, and can they do that themselves, or does the client need to call? Can you talk us through that?
So I think most importantly, within the sort of sector, the most important thing is that we are voluntary services. Most of the work is done by the client at the end of the day in recovery. So we do recommend for referrers, the best option would be to give the client our phone number, the relevant intake number, for them to give us a call and have a chat to the intake clinician to find the most suitable treatment going forward. Here at Turning Point, if a GP wishes to refer a client, they're welcome to send through a referral to here in Box Hill, and we will follow up with the client following that referral.
Okay.
So while it is really great if the client can give us a call, if you have your client's consent to share their name and phone number, they're welcome to give us a call, share the client's name and number with us, and we can call the client. We'll call a couple times, leave a message, give them our details, and they can call back if they don't get through. But yeah, it's just really important that the client is consenting to the referral.
Great. So we've got both those options there. That's really fantastic. So it's really important for those referrers to get the client's consent if they'd like to make the referral themselves. Okay, fantastic. All right. So complementary services, other services, I guess, that are not those, standard, intake assessment, counselling, care and recovery, non-residential withdrawal. What else? And this won't be a comprehensive list, but what else do we often find is useful for clients in the East?
So I guess specifically in regards to Turning Point here in Box Hill in the Inner East, we do have addiction medicine and addiction psychiatry doctors that are available to people within the eastern suburbs. Doesn't have to just be the Inner East. So those are specialist services that can provide one-off appointments or longer-term care, depending on the client's situation, and they're accessed through a GP referral that will be reviewed and triaged accordingly. We also have our specialist pharmacotherapy clinic that deals with opioid replacement therapy for clients, so methadone, Suboxone, or the longer term injectables like Subutex and a few others like that. Ultimately, if you have questions about ORT, I would recommend calling Direct Line to begin with because there's numerous SBS or pharmacotherapy programs within the East that could be accessed by the client. And I guess lastly is Smart Recovery, which is a group type therapy that we recommend for a lot of our clients. It's online, so really easily accessible. And so they're group-like meetings, I guess, like you'd think about AA, but slightly different. They sort of focus more on short-term goals over the next week and can be quite helpful to go alongside other services that clients might be receiving.
Fantastic. Emma?
Yes, I mean, there's a lot of different services outside of that counselling and care and recovery and detox. So there is the family reunification program, which is specifically for people on a family reunification order that have child protection involvement. That child protection can refer directly to the family reunification team, but are welcome to call intake and we can support that. There's dual diagnosis, so people with more acute mental health that also have drug and alcohol use. There's also family, alcohol and other drugs counsellors who also support family members of people who use. So if you are, a partner or a mother or a child of someone who's using substances, there's support for them as well, and we can make that referral. And there's parent support groups as well. As well as also there is MSRS, so people who are using prescription medication, there's specific counsellors that we can refer to for that as well.
Yeah, and that's the Medication Support and Recovery Service, for those who don't know. I wanted to mention peer support groups that we have. We also have peer workers available. There's also youth services in the catchments that may be useful for youth clients, family support services as well. And another one that I think is handy is the Reconnection Service, which is specialising in benzodiazepam withdrawal and management. So that's just a smattering or a sprinkling of the services that are available. But as you can see, our intake workers actually really understand what's out there. And there's also the option of calling Direct Line, as Marion mentioned as well, which is a good general information service for drug and alcohol and also staffed by counsellors. So there's lots available. It's just really knowing how to access it, isn't it? All right, so finally, we're going to talk through some tips or common mistakes that might help referrers have a smoother time or clients to refer in as smoothly as possible. Can you tell us about that?
I'll start with a few that are sort of turning point specific in regards to our Detox, which is really popular within the eastern suburbs. So a few things about that. Mostly, as I said, COVID has really impacted our so the way we're able to do that at the moment. If you've got any questions, best to just give us a call. We are happy to explain it and talk through it so that we've got a really good understanding of the current situation, because it is unfortunately always changing. Also in regards to our Detox, while we do normally offer 7 to 28 days stays, and a lot of people will refer for that longer stay, ultimately that length of stay is decided on by our team of specialised doctors who will review every single case and decide what is most appropriate. So no length of stay is particularly guaranteed. It's just dependent on the client's situation and what our team deems most appropriate.
That makes sense. Great. Emma, did you want to add anything to this one?
I think just, yeah, as we've mentioned, the service is voluntary. So as long as the client's consenting, then the referral will be accepted, and we'll do our best to link the client in with the service that's going to support them. And just our intake services are catchment based. So for the outer east, we're working with people living in Knox, Maroondah and Yarra Ranges. And in the inner east, you've got Whitehorse, Manningham, Boroondara, and Monash. Yeah. So if you've called the wrong service, just bear with us. We'll find you the right number, and we'll get you connected to the right intake service, because we do need to stick with those catchments and it's better for the client.
I think
So
as
it'll
well,
be more streamlined. Yeah, sorry, go on, Marion.
that's right. I just want to say, ultimately, at the end of the day, there's no wrong door, as Carmen said before, and we are more than happy to answer any questions. We understand that these referral pathways and services can be complicated, especially if you haven't referred or used them before. And so our intake team are more than happy to have a chat about what might be most appropriate and what's available for a client or for a clinician who's sort of wanting to inquire on behalf of a client.
Fantastic. Emma, did you want to add anything else before we wrap it up for today?
No, I think that's it.
Great. Well, thanks so much for watching. And if you've made it this far, you've really got a pretty basic but good overview of alcohol and drug services in the East and what's available. As we said, this isn't everything that is available. And also, I guess it's important to remember that, you know, there's some experts within these organisations that can actually help your client work out what's the right thing for them. And obviously, we're very client-centred as well, so the client's got to come along for the ride. I really appreciate your time, Marion and Emma. I know you're really busy, but I just hope you have a wonderful day, and thanks for your time today, and thanks everyone for watching.
Thanks.
Bye.